most important speech in the final day of the Labour conference at Liverpool came from the Health Secretary, Wes Streeting. Now, he is a pretty outspoken bloke, and he didn't mince his words. The NHS, he said, was letting people down, and it had to change. This is not going down well with some inside the NHS, but Streeting also had some good news because he's rolling out a new scheme devised by surgeons themselves to greatly speed up the number of people who can have operations, and he's trying it out in the parts of the country with the largest number of people currently off sick from work. Now, what interests me, and I hope you, is how this is actually done. And you may be thinking, what do the politicians know about this stuff anyway? Which is a good point. Except that my next guest is Zubir Ahmed, both Labour MP for Glasgow South West and Wes Streeting's Parliamentary Private Secretary, but also a transplant and vascular surgeon who knows, I hope, all about this stuff. Mr. Ahmed, thank you very much indeed for joining me. Can you explain how these hubs are going to work?
Well, good evening, Andrew. It's a pleasure to be with you. And what these hubs do is really encapsulate the true spirit and the ingenuity of the NHS and remind us that it's the talents that lie within that are the secret for its long-term success. And what they fundamentally, first of all, obviously do is they create capacity and get patients treated and sorted faster. But secondly, what they do is they reveal how if you release frontline NHS workers to do the job they were trained to do, how much additional value you can extract. In these particular cases, in Guy's and St Thomas's, you have 2 or 3 operating theatres working simultaneously. You have surgeons moving between operating theatres so that there's less downtime between cases coming into an anaesthetic room and the case leaving the operating theatre. But fundamentally, what they showcase is the fact that you have teams and you have familiarity between those teams, how much of the operational bottlenecks that you can overcome.
Now, I compared them earlier on. It's been done by many people to F1, Formula One pit stops, and that's probably a rather silly comparison. But is it the case that you have one operation after another, after another, after another, and they're all more or less the same? So a series of hip operations done, a series of cataract operations done, or whatever it might be, by the same surgeons again and again. Is that how it works?
Absolutely. It's about the same type of operation being done on the same list over and over again. And the Formula One analogy is actually not so inaccurate in the sense that every member of the team has their role. They have a pride in that role, a pride in delivering that role efficiently, and then the end result is for everyone to celebrate together, and that is a happy patient who's free of pain when it comes to hip replacement or free of cancer when it comes to something like prostate cancer.
And is there evidence that this system actually increases the number of operations dramatically?
There's certainly evidence from places like Guy's and St Thomas's Hospital, a place I actually used to work in myself, that you can impact on the waiting list quite quickly. And this kind of practice is the best of the NHS, and that's why now we're taking it to the rest of the NHS and targeting it in areas of high economic activity where the waiting lists are the highest as a percentage of the population.
And so this, I mean, some people listening to this, it seems a kind of obvious thing to do. Why is it not done all the way around the NHS already?
Well, I think there are many reasons for that. Part of it is a lack of investment and capital infrastructure, which has obviously been put in plain view by Lord Darcy's review. Partly it's because we've not protected the front door and the back door of the NHS, and therefore the first victim of that always seems to be elective care and routine operations being cancelled. So that is part of the reason. But also, we've not kept pace with technology as we should have. We're still in an analog age when patients rightly demand a digital solution. And a lot of this is backed up by, a high degree of concentrated digital and artificial intelligence activity to plan operating theatre lists. And so a lot goes gone behind the scenes before the day of the operation to make sure that this is actually possible and that the maximum capacity is being achieved.
You kind of answered my next question already, which is creating these hubs all around the country, which seems, as I say, good news and a very good idea indeed, will require quite serious upfront investment.
I think that's correct, but I think what it requires in the longer term is also the right type of investment. And what we have realised through the Darcy Review is that consistently over 14 years, the Tory government raided the capital expenditure budget to patch wounds in the NHS on a year-to-year basis just to get by. And I believe they did that as someone that works in the National Health Service because they fundamentally did not believe in the founding principles of the NHS. And now that we have a Labour government that's committed to its long-term viability, I think you'll see more of that funding being targeted into the right areas with a long-term lens.
So all around the country, and many of them, people will be listening to this show, I'm sure, are people waiting for hip operations or knee operations, sort of relatively routine but very, very important elective surgeries. When are those people going to be able to get in touch with their local GP or the hospital and find their operations are being speeded up and those long and painful waits are going to end? What's the sort of timescale for this?
So for this particular project, we have identified the 20 hospitals or the trusts where we think the need is the greatest. You'll see, I think, movement relatively rapidly in weeks rather than months, and certainly by the end of the year. We have the clinical know-how, we have the clinical knowledge, we have the clinical intelligence, and now we have to spread it out across the country.
Dr. Zubir Ahmed, thank you very much indeed for that lucid explanation of what Wes Streeting, your boss, was saying in the Labour conference. Much appreciated.